Hello, everybody. This is Sumit Khetarpal on behalf of Gut Warriors. And today we have a real gut warrior. We have Abby. She's a longtime SIBO sufferer. And we asked her today to share her experiences with you. So, Abby, thank you for coming forward. And I know it takes a lot of strength to do this. Most people are not very comfortable with sharing their health issues and being vulnerable. So, thank you for doing this for a bigger cause. Can you please introduce yourself and talk a bit about your SIBO journey so far and how did you get a SIBO diagnosis?
Yeah, absolutely. Thank you so much, Sumit. So for everyone, I'm Abby Dancause. I have been suffering from SIBO for about 7 years. And specifically, my type of SIBO is SIBO with methane and constipation, also paired with SIFO, fungal overgrowth. Certainly has been a journey. I'll talk about my onset of symptoms and all the types of testing and procedures that I've been through, but it's been a really challenging journey to go through with not always getting the answers that you need and just very challenging diagnosis. So just talking about, how did I find out that I had SIBO? This was 7 years ago. I had really what felt like an onset of sudden symptoms of extreme abdominal distension and bloating, along with abdominal pain. I was otherwise a healthy 24-year-old. And so that was kind of frightening at the time. And so other symptoms have come and gone: brain fog, fatigue, even some skin issues like scalp issues, nausea. But what's really been the most challenging is the pain and the bloating and distension that goes along with it. So it certainly took me a few years to even be diagnosed with SIBO and learn more about what was going on with my gut. So when I first, age 24, getting these symptoms, I went to a PCP and basically thought I just had constipation, possibly an abdominal mass or hernia, because of the bloating and very visible distension on my abdomen. So I first got ultrasound, CAT scan, was actually given lactulose for constipation, which now we would know is probably triggered further the bacterial overgrowth that I had. So beyond initial testing with a primary care practitioner, I was referred on to GI. So I have seen 4 GI doctors over the years. I actually did get a SIBO breath test early on in my journey. And I was looking back at the notes and I realized that I only got a hydrogen breath test. This would have been back in 2014 or 2015. So interesting to look back on now and realize that, so this breath test that I took, I was negative. So I went through this journey for many years thinking that I didn't have SIBO, actually, because the testing was not positive for the hydrogen breath on the test.
Was it a glucose breath test or a lactulose breath test?
It was a lactulose breath test. So who knows if there's any other errors with the test that could have happened, because present day, I know that I have methane, and my breath tests have included in more recently hydrogen as well. So hydrogen and methane combination, but with the constipation, I tend to really focus more on trying to treat the methane overgrowth, and I've responded more to the treatments that are focused for the methane overgrowth. So after getting a negative SIBO breath test, we move on to lots of other testing. Unfortunately, really moved on to colonoscopy, endoscopy, later on a capsule endoscopy, lots of biopsies, testing for celiac, lactose intolerance, fructose intolerance, pancreatic enzyme testing. And so basically, I could keep listing out things here, but the long story short is getting like a full workup by PCP and GI with nothing wrong. So I otherwise appear to be a healthy 24-year-old at the time. Blood work looks good. So it's presented as, you know, good news, you don't have colon cancer, you just have IBS.
Right.
And that's truly how it's presented when I'm sitting in the exam room, very much suffering from the pain, bloating, you know, numerous other symptoms that I'm feeling like I've not only not gotten any relief, but also not received any validation or acknowledgement from any practitioners that there is something else happening here and we're just not quite sure. And we may just have to refer you elsewhere or, you know, look to some other alternative treatments. And to at least not be told that was really mentally and emotionally challenging. To just be told that you're healthy, nothing's wrong, you know, it's just IBS, you know, it's not a big deal, is the implication, even if it wasn't said directly like that. I definitely felt like I was being spoken to in condescending ways in some of those atmospheres in some of my GI experiences. So moving on, I have seen naturopathic doctors. I've taken, you know, supplements. We can talk more about all the supplements and treatment realms, but I've done acupuncture, I've done physical therapy, lots of other treatment mechanisms that when I tell you, if there's a possible treatment route, I will try it. I really shouldn't forget like the diet component too, of like low FODMAP, you know, cutting out gluten, cutting out dairy. I will do it. I truly will do it. And so unfortunately, just to link it back into present day now, after talking more about my journey, I have been able to get the SIBO a little bit more under control, and in the SIFO as well. I've had some good past 2 years where I felt less bloating and distension. We'll talk more about how and what I've been using, but unfortunately, the past 3 months, I've completely regressed in my symptoms. And so it's a reminder that this unfortunately is a really long journey and we can make progress, but it's not always guaranteed. Even these antibiotics that are touted, they have a high rate of relapse. So, you know, we're trying to get to a good spot in researching more about SIBO and the treatments, but it also, we also learned that we're all different. Us as SIBO patients, you, myself, everyone else out there suffering with SIBO, what works for me might not work for you, even if we have the same type of SIBO. So that is really adds to where we need more research around SIBO, around understanding more about our gut microbiome. So it feels like what I've been treating, it's like an ever moving target. Sometimes it's the bacteria overgrowth, and then it could be the fungal overgrowth.
Yeah.
Sometimes treatments work and sometimes they kind of stop working. We have to cycle through different treatments.
Great. So you talked that leads me to my next question. You talked about the antimicrobials, the antibiotics, the antifungals, and obviously that's a big component of SIBO, which has its root in some sort of a gut dysbiosis. So can you talk about what are all the different antimicrobial treatments you've had, whether pharmaceutical or herbals, and uh, whether they have helped you, which ones helped you and which ones did not?
Definitely. I'll start out talking specifically about the antibiotics courses that I've taken. And I should say, I'll talk about which antibiotics I've taken, but I really have seen no improvement from any antibiotics. I don't feel that I have been impacted negatively, at least from what I can tell. But based on the amount of antibiotics that I've tried, it's quite possible it had some negative impact, but I'll just say that really I have not seen any improvement or any impact from antibiotics. So I have taken 2 rounds of rifaximin, at least a year apart. So they were separate treatments, which we know is touted for at least hydrogen SIBO. I have tried vancomycin, which is the only antibiotic that I at least got some positive improvements in my bowel movements, but it was limited and didn't go beyond that scope. I've also tried metronidazole, and I've done a course of rifaximin and neomycin together. And lastly, I've done Cipro and Flagyl together, which was actually part of a clinical trial that I did for fecal transplant, oral fecal transplant. So that was part of my assignment within the trial, was to do that antibiotic route and then the fecal transplant, which was another avenue I took as an alternative treatment method that I thought was really going to be my saving grace, but unfortunately just didn't have any impact. And I think within the past couple of years, I think we've learned more. There's been more publications about fecal transplant not being as impactful for IBS as is usually what it's published for, but for SIBO as well.
Cool. Very good. So if you think about all these experiences across the drugs, the supplements, the lifestyle changes, what would you say has helped you the most thus far?
Yeah. So I didn't even mention, I have done a lot of different herbal supplements, and the herbal supplements have actually been helpful for me, way more helpful than the antibiotics have been, with the caveat that it's very trial and error with the herbal supplements. So I have had good luck with taking motility agents. Specifically, in my case, I've been taking a supplement called Motility Activator, some different tinctures or plant extracts that help to keep the motility going, because in my case, I have the slower motility. I take some other supplements that help to attack the bacteria, really. And examples of those are Atrantil and an allicin supplement. So one other thing I want to mention for anybody that has SIFO is I actually had a very good reaction to nystatin as an antifungal. And it's something that I have continued to take. And it really was the starting point of my healing. So I really do want to call that out, is taking an antifungal, because I do feel like in the Western medicine world, I think the yeast fungal overgrowth can get a little bit of an eye roll in some areas of even kind of believing that that type of thing can exist, a yeast or fungal overgrowth. So to begin taking an antifungal medication, I immediately was starting to get some relief in my symptoms. And I feel like I'm at least at a more manageable case of SIBO, although I do have these kind of ebbs and flows of worse few months with the pain and the bloating, and I have to kind of recirculate in different herbal supplements. But taking an antifungal for my case of SIBO, SIFO really made a huge difference for me in my healing. So to answer your question, in terms of what has made me feel the best or have the most impact in my SIBO treatment thus far, I would say the herbal supplements, like I mentioned, motility agents, other herbals focused on killing bacteria and fungi, as well as some of the lifestyle changes. While I don't think they're getting at the root cause, the lifestyle changes definitely help with symptom management, like toying around with the diet, the lower FODMAP diet, meal spacing, trying to give your digestive system some time to digest between meals or overnight, not having any liquids when I eat, to just give my digestive system the best opportunity to break my food down, because that is really a challenge, low stomach acid. So I would say lifestyle changes and the herbal supplements and the antifungal has been the most beneficial for me. But really, I do feel like I'm still a student of the SIBO research. So I'm still in my journey, but I have learned a lot, and I'm really happy to share what I know and what I've been through.
Excellent. So so Abby, as both of us know, this is a tough disease. Starting from the diagnosis, the treatments are not well known. A lot of doctors don't know about it. And, part of what I kind of consider frustrating, you talked about it a little bit, is it's not considered a serious disease. It's like, even the doctors will tell you, oh, it's just IBS, So can you talk a little bit about when you're going through tough times with this disease, how do you muster emotional strength in dealing with this? What really keeps you going?
That's a really great question. And I really want to thank you for acknowledging the emotional and mental toll. I know that you can relate to this as well, but I wanted to emphasize, because it's really one of the most challenging aspects of having SIBO, and it's often overlooked for us as chronic sufferers, even from people that are close to us in our lives, as well as our doctors, and being able to relate to that long term like suffering, because it is an invisible, quote unquote, invisible illness where you don't present necessarily as an ill or chronically ill person. So it's challenging to get validation from your doctors and others. But we know more about the gut-brain connection and how it impacts our mental health. So there are times in this journey that I certainly have felt very defeated and hopeless. You heard about my journey, but having hope really is so important to keep going. And what really gives me hope in mustering the emotional strength with SIBO is knowing new treatment options that exist, and whether it's getting recommendations from my doctor of new treatments, in reading and researching advancements from IBS and SIBO experts. You really have to be your own patient advocate, which is challenging. It's a full-time / really part-time slash full-time job to have SIBO and also do the research and try to find a doctor that is up to date on this research and doesn't just, treat you like you have IBS. So it's hard to find a doctor. It's hard to find support, and it's hard to keep that will and that strength to continue to look for new answers. So to summarize, it's really researching and knowing that new options exist is what keeps me really hopeful, is to be trying a new supplement, to be trying a new herb, or even like lifestyle, be working on meditation as a relaxation, anything really, to just have more options, to hopefully find the right combination of diet, lifestyle, supplements, and support to see more improvement. And so I do want to mention that what's been really helpful for me, actually, that can also be kind of looked down upon from Western medicine, is I have been seeing a naturopathic doctor for the past couple years. And that is a component she's the piece that has really gotten me more into the herbal supplements, really, I don't want to say aggressively, but kind of having a more aggressive like algorithm to treat me, and not just kind of suggesting some random things, but seeing a naturopathic doctor that is very progressive and up to date with SIBO research, which is not every naturopathic doctor out there. So it again reinforces the concept that it's hard to find a practitioner to treat SIBO. But I do want to tout as an alternative for anybody that has reached the end of the road with a GI doctor, or second, third opinions with GI doctors, that herbal supplements can be really impactful. And I do think that there are naturopathic practitioners out there that really do have some good knowledge of how to support you by looking at like your bacterial makeup in your stool panel as an example, to help get down to your specific case of SIBO, and not just treat it as a general IBS type of case.
Excellent. Very good. So, Abigail, we've come closer to the end, and at the very end, I guess I'll say, is there, knowing everything you know about SIBO, what would you say to a SIBO patient who's in the middle of this disease? Do you have any last message or words of wisdom, if you will, for a SIBO patient?
Yeah, definitely getting a support system. And it may be doing some research online, finding other people that are suffering with similar symptoms. I've been able to find some progress or new treatment options through learning from others online. I don't want to tout just reading Google as the end all be all of good medical advice, but having a support system for this really mentally and emotionally challenging condition, and being your own patient advocate, which is finding some treatment options and bring it to your doctor to talk about. Some of the antibiotics and other treatments that I mentioned during our discussion, I actually found in some of the gastroenterology journals, peer-reviewed journals, and I brought it to my doctor saying, hey, I've been reading about this rifaximin, or rifaximin and neomycin seems to be, impactful for SIBO, and so I would like to try this. And so sometimes you have to be your own patient advocate, and it is hard to do, but do your research, find your support system, whether it's your friends, your family, and talk about it. Others can help you get through this and learn about other treatment options. So I really wish everybody well who is suffering. This is extremely challenging.